Hi, I'm Dr. Jennifer Ashton, and welcome to Health and Wellness. Surgical sterilization, or a vasectomy in men, is a form of birth control often considered to be a permanent method of contraception. And here to tell us more about the procedure is New York City top urologist, Dr. Harry Fisch. Thanks for joining us, Harry.
Thank you for having me here.
Okay, first of all, the term surgical sterilization is often a little off-putting for the average person, but we need to debunk those myths right now, because when you talk about vasectomy, that is a very important procedure that most people don't know about. What do you tell an average man in your office who comes to you saying, what should I know about this?
Well, you know, sterilization, first of all, you said something really interesting. That's a terrible word to use because it scares people.
Right.
You know, we have to use the right terminology so people can understand what we're talking about. And we're talking about really contraception.
Right.
And contraception, there's so many different varieties of contraception. And it turns out that probably the easiest method of contraception is vasectomy. And this is exactly what I tell couples. Because a lot of times, obviously, it's a couple-related issue.
Sure.
You know, couples, they're married, they have kids for the most part, and they want to know which method to use, what way of contraception might be better. And without question, I tell them vasectomy is the simplest and maybe, ready, the safest. The vasectomy is very easy. Most of the time, nearly all of the cases we do in the office. Which is in the office. And you know, you got to be good at doing this, which we as urologists, we are very good at doing this.
Right.
And that patient comes in, we numb up the scrotum with a little bit of like a lidocaine, which is something people use in the dentist's office when they have a tooth extraction.
And do you do that with an injectable form of lidocaine, or the cream or ointment form, or the spray?
We have a certain spray that we use no needles when we do a vasectomy.
Okay.
It's a fantastic way of anesthetizing the vas deferens, the vasectomy area. And then the vasectomy takes, ready, about 15-20 minutes. Essentially, we use a microsurgical technique, the new Chinese method, the no scalpel, no needle vasectomy. They came up with this technique that isolates the vas deferens in about, you know, literally 5 minutes from the time we start.
Now, what about the initial post-procedure, post-operative period? It's about 2 days. What's the recovery like?
Well, the recovery, if you do it quickly without, obviously, you know, as you're a surgeon, you know that the less trauma we do to the surgical site, the less pain. So there's really not a lot of pain. However, we do tell patients they have to rest for the next 2 days. And a lot of times I'll tell them if there is a little bit of swelling to use some ice packs, but anti-inflammatory.
Things like Motrin are good?
Exactly.
Now, what about residual pain? Because I've heard conflicting reports about what percentage of men might have pain that doesn't go away after a couple of days. What do you tell your patients?
I'll tell you, if the man is really interested in getting a vasectomy, listen to this, the chances of them having discomfort afterwards is very small. If a man, this is just my personal experience, if a man is not ready for a vasectomy for whatever reason, they're going to complain, not just before the procedure, during and after. So the truth is, there's very little discomfort and very little long-term problems with a vasectomy. Although some people do have discomfort that can last for 3 to 6 months. But it is rare. It is rare.
We're going to take a quick break for a word from our sponsor, and when we return, we'll hear what you need to know after your vasectomy with New York City urologist Dr. Harry Fisch. Stay with us. So, Harry, let's talk about what men need to know after the procedure.
After the procedure, we tell guys they need to ejaculate about 10 or 15 times before they get another semen, before they get a semen analysis to really evaluate whether the vasectomy works.
So they have to, just be clear, you recommend that they use condoms.
That's right.
During
you have
that
to use
time.
whatever contraception you used before. You need to use it after the vasectomy until you're cleared by your urologist or the person that did the vasectomy. And essentially, what are we looking for? So a guy just goes into a room, produces a specimen. It could be at home or at the office, the doctor's office, not their office. I don't recommend that. The home or
that
doctor's
would be
office.
odd.
And actually, the urologist will look to see if there's any sperm in that ejaculate. If there's no sperm, then they're cleared. We ask them to do it twice to be safe. And that could take about 6 weeks to 3 months maximum, for the most part, to clear the sperm. And once they clear the sperm, they're good to go.
One myth that I hear all the time from men and their wives or partners is that they think sexual function will be affected after a vasectomy. not true.
Oh, not true at all. As a matter of fact, sex can be better because there's less of a issue with having children.
Sure.
For the couples that obviously don't want to have children, that's why they're getting a vasectomy. So the other thing that's important to know is that you can reverse the vasectomy.
Yeah, so let's talk about that.
Essentially, we reconnect the tubes, again, microsurgically, in a way that is really non-traumatic, as much the discomfort as you would have during a vasectomy. People think, well, it's so...
Done in your office?
No, it's not done in the office. It's a microsurgical technique that takes about 2 hours, sometimes 3 hours.
Harry, thank you so much, and hopefully this word will get out and more men and their wives and partners will know about vasectomy and explore those options. So thank you for joining us for another episode of Health and Wellness. I'm Dr. Jennifer Ashton. Until next time, wishing you good health.